I want Republicans to know that we officially have found a death panel in the American healthcare system. So I'm going to wait patiently for their outrage on this story. Let me break it down for you here. Raw Story explains, quote, just last week, 18-year-old Kansas resident Levi Ross said that it had been a month since doctors discovered that he had spinal cancer, and already the tumor had doubled in size. Ross's doctor advised him to get treatment out of state, but after not responding for weeks, his insurance provider rejected the advice. They say he was just days away from dying when he fled the state and found treatment at a hospital in Tennessee. So what's the problem? They continue here, quote, 3 health insurance companies now coordinate the care for about 400,000 Medicaid patients in Kansas. It's the new for-profit system called CanCare. Getting out-of-state care required a special 2-step approval process. In the end, the insurance company might reject the claim if it determined that the patient could receive similar care in-state. CanCare rejected Ross's claim, and his doctors said that there was little hope of saving his life until St. Jude Children's Hospital offered to perform the surgery in Memphis. By the time Ross finally had surgery, his tumor had tripled in size. His doctor said that he had only 1 week to live. Quote, there's no way that by staying in Kansas that I would have stayed alive. I feel pretty good considering I've had a massive surgery. I'm just happy to live. Wow. So let's review here. Kansas decided to privatize their Medicaid system. As a result of that, it's now a bureaucratic nightmare with the for-profit health insurance companies rejecting claims for more people. He asked to get treatment for a tumor on his spine that he needed treatment on. They took weeks to respond to his request, and when they responded, they said, yeah, no, we'll pass on that one. And so what happened? He had to flee the state to go to Tennessee, and in Tennessee, they're like, what do you... This isn't a question. Of course, you need the surgery. Of course we're going to give you the surgery. What are you, crazy? Of course. And then they gave it to him. And he's just like, look, I'm just happy to be alive. So because Kansas went to a for-profit Medicaid system, they now reject more people who need the care, and those people oftentimes, and in this case specifically, can die. Had to flee the state to save his life. So we have death panels in America. The conservatives are right. They're just not the death panels that they think they are. See, in their mind, it's like the death panels are from Obamacare and the death panels are from the government. It turns out the exact opposite is true. There are no death panels in actual Medicaid or actual Medicare or, in government-funded healthcare. The death panels are really in the for-profit insurance system. Because think about it. How do for-profit insurance systems work? By their nature, simply by the way they're designed, they have to deny care as much as possible in order to pad their bottom line and make more profit because they have a fiduciary responsibility to their shareholders to do so. So they don't have a choice. They have to care about the profit margin. And how do you make more money if you're an insurance company? By denying care as much as possible. Whenever you can weasel your way out of it, you weasel your way out of it. So in this case with this guy, they weaseled their way out of it because they care about their profits. That's what their main focus is, by definition, by the way the structure is set up. With a government system, that's not how it works. Now understand, we've spoken about time and time again in America, we've always had death panels, and the death panels have always been the insurance companies. The insurance companies used to have entire boards for this process called rescission. Rescission is going back into the history of your client and looking for anything that you can use to then justify nullifying the contract with them or voiding the contract with them. So in other words, if you wrote your middle name or your middle initial on one health insurance form that you signed, but on a different one you didn't, they could use that and say, well, you screwed up your paperwork here, so we're not going to pay out on the claim that you put in for treating your cancer or whatever other problem you may have. Sorry! And then people go bankrupt that way, which is why the number one cause of bankruptcy in America was healthcare bills. There's another example. Obama spoke about this when he was candidate Obama back in 2007. There was a woman who was rejected to get cancer treatment because the insurance company said, you didn't tell us about your pre-existing condition. You had acne back in the day. She's like, that's acne. All kids have acne. What do you mean? That's not a medical condition. It's not a pre-existing condition. They're like, yeah, you say that. We disagree. Because maybe it was acne or maybe it was cancerous skin lesions and you didn't tell us it was cancerous skin lesions. So therefore, maybe you already had cancer and didn't tell us, which would be a pre-existing condition, which means your coverage is done and we're not going to pay out for your claim for your chemo treatment. I mean, there are people who have left the industry and they tell the horror stories. They say, look, my job, I was the person that was put into place to try to weasel our way out of paying out on people's health insurance claims. There are your death panels right there. The for-profit health insurance companies, not the government, the for-profit health insurance companies, and this proves it, as does the history of healthcare and health insurance in America. So yes, you should be outraged about death panels, but you should be using that outrage and channeling it towards a single-payer system, not to go further down the wrong track of more privatized health insurance and healthcare, which would exacerbate the problem and ironically give us more death panels.